So let's begin. At a time when, well, I hope many of you are living in countries where you're starting to come out of a lockdown, however strict it was where you were, perhaps feeling glad that you survived, and not only that you survived, but that your health system also has pulled through. Well, spare a thought for those countries which still haven't hit the peak of the disease, the first wave of this disease. Countries like Yemen, where even before this global pandemic struck, was described as the world's worst humanitarian crisis, with a health system that was barely functioning, and now where the health system has all but collapsed. Countries like Afghanistan, regarded as the world's deadliest conflict, which is now facing multiple crises all at once. Countries like Syria and countries across Southeast Asia, as well as many parts of Africa, which are confronting not just this global health pandemic, but also the fear of a hunger pandemic as well. Now, of course, you may be thinking, some of you listening in tonight, watching this discussion, well, that's a long way from us. But I think you'll hear tonight, time and again, if you haven't heard it already, that we live in a world now where none of us will be safe until all of us are safe. And that includes people living in the most fragile and vulnerable countries of all. But let's get started with our terrific panel, which joins us tonight. First, at least it's in the corner of my screen, I think I have to describe them as the mother and father of Sama, because a little girl named Sama has become world famous. She's won every possible award there is to win in the world of television. Her parents are Dr. Hamza al-Kateab and Waad al-Kateab, who were behind this historic and really crucial documentary about their lives in Syria. Dr. Hamza worked between 2012 and 2016 as a doctor after he graduated in the great city of Aleppo in northern Syria. And he was one of the last remaining doctors in Aleppo. And if you've seen For Sama, and I hope you have, you'll know the harrowing scenes when they finally were forced to leave their hospital and home. Hamza moved to the United Kingdom with his family, so we're glad to see you here, Dr. Hamza, with Waad. And he's now working as an operations manager with Amina Card. It's a scheme which provides a financial lifeline to people trapped in conflict areas, and it's hoping to expand across the Middle East. With him tonight, as always, by his side is Waad al-Kateab, who was the woman behind the camera and in front of the screen, documenting her life and not knowing at the time that it would become this award-winning documentary. And because we must all believe that good things come out of bad, Hamza and Waad fell in love in Aleppo, were married and had two beautiful children. And Waad is now a filmmaker here in the United Kingdom. Welcome, Ahlan wa sahlan, Waad and Hamza.
Thank you. Thank you. Good evening for everyone.
And in the top corner is another woman who's had a challenge just to survive even her childhood, Dr. Weeda Mehran, who grew up in Taliban-controlled Afghanistan and then lived as a refugee in neighboring Pakistan. And despite, at the time, the Taliban's best efforts to prevent women from getting educated, she's risen right to the top and is now leads on the master's program in conflict, security and development at the University of Exeter. So Khoshamadi to you, Dr. Weeda Mehran.
Thank you. Good evening, everyone.
And last but not least, there you have it, David Miliband in his kitchen, who is the president and CEO of the International Rescue Committee, Humanitarian Relief Operations. They work in more than 40 countries around the world, most of them affected by war. And its refugee assistance and settlement programs operate in 26 cities across the United States. And many of you, of course, will know that David Miliband was also a foreign secretary in Britain, where he made an impact of a different kind. Welcome to you, David.
Thank you, Lyse. Very nice to be with you, and really great to be on a panel with such amazing people.
Great. Well, thank you to all of you. So let's begin. We want to first look close up at both Syria and Afghanistan, and then we'll broaden our discussion to look in general at some of the issues affecting issues which are dealing with these multiple crises at the same time, including, of course, COVID-19, this deadly disease. And we're going to begin in Syria, a country which never used to leave our headlines and is now sadly a country which is approaching nearly its 10th year of war, where most of the territory is now in the hands of President Assad's forces, except for the province of Idlib in the northwest and areas under Kurdish control in the northeast. And now a country which at the start of its uprising in 2011 was a middle-income Arab country is now a country where nearly half of the population go to bed hungry at night and where 1 million are said to be on the brink of starvation. And with all that, still coping with COVID-19. Let's begin with you, Dr. Hamza. What have you been hearing about the situation when it comes to the coronavirus in Syria?
So, like, talking about it, like there is very different aspects to talk about it. So, on the like health situation in northwest Syria, where about 3 million people living, mainly like half of them in camps, in crowded camps, which like social distancing there would be kind of impossible to get. With also like kind of don't have the it's hard also to raise some like awareness campaigns around in those areas where like there's no TV, few radio channels. And on regarding the health situation, the numbers are tragic because about like there is only one doctor for every 10,000 people, and about one hospital bed to cover about 1,350 people, and one ICU bed with ventilator for every 20,750 people. So spreading of COVID-19 there would be like a major disaster. The first few weeks of the pandemic was very like worrying with like lack of laboratory tests. I think it was worrying like in the US or in the UK. So imagine with like just a territory which are shelled by the Russian regime, where like being at the hospital itself is a great big risk that the doctors are taking. And then above all of that, like the lack of laboratory tests, the lack of like clear diagnosis and a treatment plan of COVID-19. So it was very like a chaotic situation. Now things kind of like a little bit better with the little support, I would say, from WHO and the aid organizations. But like still the numbers that I've stated are really worrying. When especially expecting like spreading the pandemic in like one camp, where like it's nearly impossible to apply social distancing, would result with a huge number of patients. I used to say injuries because we always use about the injured people from the shelling, but now it's also like a new level of healthcare that needs to be implemented in the area.
So that's the situation in the northeast, where you have, as you say, a lot of displaced people who've been pushed time and again, year in, year out from the war and already living in a very debilitating situation. Waad, can you fill us into what is happening elsewhere in Syria? Is it also the situation is dire there?
Yeah, I just want to add to what Hamza said, because even like in camps and people are like living in places after like being displaced for times. Some people like literally over 6 times they've been displaced from one place to another inside Syria. And in addition to this, like people already like feel exhausted a lot, and also like there's no access to even like water or like just to wash your hands. This is something like hard to like do every like what we need to do as like we are now living in London. Also, like when we are talking about like stay home, there's so many people who just live in camps and in tents, And so even like stay home for them is something kind of like privileged, you know, it's kind of dream. They don't have that. On the other hand, also under the regime control in the areas where Assad is controlling, like we really heard about people being arrested just because they have symptoms, or they talk about there is like spreading of COVID-19 in these places. Also, like if we want to just like amplify the problem of the detainees and the people who've been in Assad prisons for years, for so many families who still have some hope that their like beloved could be alive until today. You know, with this COVID-19 issue now and the prisons with the tortures, and like it's just something we can't even like imagine how the effect will be for these people. So we are not just talking about like, you know, normal pandemic, which we felt here as we living now in London. We felt so much worried about ourselves, our families. But when you look at Syria, it's totally like different, like lack of everything, literally.
Dr. Weeda, you're listening to that. Does a lot of it sound very similar, despite very different country, obviously, but Afghanistan as well, shortage of supplies, people who are also displaced. What is worrying you most about Afghanistan?
It does sound very similar, and particularly in Afghanistan, the official cases appear quite low. Cases of both infection and deaths. For example, the official cases statistics that the Ministry of Health has provided in Afghanistan is about 733 so far deaths in the country, which is very underestimated given all the issues that the country is facing. Lack of hospital equipments, lack of ventilators in one regional hospital in Afghanistan, which is responsible for 3 or 4 provinces. We only have 8 ventilators. And that shows that this is a grave problem, especially right now that the rates of infection are increasing in the country. And that makes it a lot more difficult. The reason for lack of these reliable statistics, which is quite worrisome, is that the government has not been able to collect the statistics. People, for various reasons, do not actually report rates of, if they contract the virus, they do not report it. They do not seek help sometimes from healthcare services because they believe that if they do go to health facilities, to clinics, to hospitals, that they will not actually get the kind of help they need, and they might be exposed to more problems. So that's another reason that people do not actually go there. So the government does not, as a result, there would be a lot more cases of infection that go undetected in Afghanistan. And one other problem on the top of that is that so far in some parts of the country, it has been a social taboo that if somebody has contracted the virus, they actually hide it. And this is similar to actually what Waad mentioned as well, because they hide it, they do not report it, and not because the government would come after them essentially, but because they think that if I disclose this, there would be others who would look down on me, who would actually try to stay away from me. And I'm not saying this is everywhere in the country, but a good number of people who were surveyed in Kabul, which is the major city in the country, they did mention that about 45% that they would not go and seek help and that they would not disclose it, which is, if it's not disclosed, that means that it can increase rates of infection. And obviously, when we discussed, we have another major problem, which is when we have internally displaced people living in camps who do not have access to proper healthcare, who do not have access to proper sanitation. And that makes the situation a lot more grave for those people. On top of that, we had a lot of returnees, Afghan returnees, refugees from Pakistan and Iran. Once the virus spread in Iran, we had many Afghans who returned to Afghanistan. And living in camps, the situation can be as bad as what Waad and Hamza were describing.
So there, both of you have laid out in two very different countries in two different parts of the world, Afghanistan and Syria, the kind of issues which all of us who are fortunate to live, in this case, many of you are living in the United Kingdom, a country where we rely on the health system, trust the health system, where community measures like social distancing and hand washing are possible. David, I know you're listening to this and nodding that the IRC has collected data about the vast gap between the resources in more fragile countries and resources in more the relatively wealthy West. Give us your perspective on this dilemma, if you like.
Thanks, Lyse. Look, I think the key thing to understand is that COVID-19 has so far been a disease that has afflicted the poorest people in the richer countries. And we're now seeing a change because the disease is moving from, obviously it originated in China, but it's hit hardest so far Europe and North America. We're now seeing that it's moving significantly into Latin America with exponential growth in the number of cases, but also in our work in South Asia, in Afghanistan, Pakistan, in Bangladesh, we're seeing very significant increase in numbers. In our work in Sub-Saharan Africa, we're very worried about countries like Nigeria, Democratic Republic of Congo, Somalia, and in what I would call the Far East, in Myanmar, we're also extremely concerned. Thailand. Now, what this means is that in the kind of what are called fragile and conflict states that I'm talking about, states that are either suffering conflict or are housing people who've taken refuge from conflict, there are two things that I think are really important to understand, and my co-panelists have hinted at this. The first is that these countries like Syria, like Afghanistan, they went into the COVID crisis with grave, grave problems facing their own populations. Remember, I don't need to tell Waad and Hamza, I mean, we're in the 10th year of the Syrian war. 6 million people are still living outside areas of government control, dependent on cross-border aid from the United Nations, which in parentheses is being threatened, but with a Russian veto in the next 10 days to cut off cross-border aid. Afghanistan, in some ways, an even longer civil war. So we went into this crisis with grave challenges for people who are the most vulnerable. COVID is a double emergency. It's a health emergency because obviously it's a threat to life itself. And as Dr. Weeda said, we know from other pandemics and other outbreaks like Ebola that people don't report to the health facilities for fear of catching the disease. So there's a health aspect to the emergency. But secondly, there's an economic and social aspect to the emergency because the measures taken to prevent the spread of the disease are themselves very injurious to economic life. And so the people who are most vulnerable suffer doubly or trebly. And if you're standing on the precipice, you can't afford to step backwards. So there's an economic and social aspect to this. I just want to mention one thing that we're, as a humanitarian aid agency that works on the front lines, we know it's women and girls who bear the greatest brunt of the increased violence that takes place and the increased poverty that takes place. So there's a big gender dimension to this. Now, just to finish the overview, if you accept, we went into this with record levels of forced displacement from war and conflict around the world, record since 1945. It represents a double emergency. What you then say is there's a third part to the emergency, which is the absence of a global political response. It's obviously the case that governments have a first responsibility to their own citizens, but it is completely myopic in a world that is as connected as ours, with a pandemic that is as global as ours, to think there can be any return to quote unquote normality in one part of the world if you can't do business, if you can't travel in other parts of the world. And so this disease is a disease of the connected world. And what we've seen is a complete absence of global engagement of a serious kind. If you contrast it to the financial crisis, when I was in government, but not responsible for the economy, obviously, there's a very significant absence of global leadership. You've got the United States pulling out of the World Health Organization. You've got the UN appeals, which are raising money, but not getting money to the front line, to NGOs. and you've got a fragmentation of global power that I think is really dangerous. And so what we fear is that those who are least protected in the most vulnerable countries are going to get the least help when they need it most. And to be absolutely honest with you, I thought things would be worse by now in some of the countries that I've mentioned. The lack of testing undoubtedly hides some of the spread of the disease, but it's also the case that it seems the disease hasn't got the fatality rates that one might expect. But the people in my health unit, in the International Rescue Committee Health Unit, they warn very strongly that we're seeing the same kind of curve of the disease in Europe, in North America, in Latin America, and we're seeing evidence of that in Africa and in South Asia as well. So I think there's really no room to be in the least bit complacent, and the voices of people as well as the actions of NGOs are really needed at the moment.
Okay, well, thank you. That's a very good wide-ranging summary of what exactly is happening across the world and in many different regions. And let's now try to look at some aspects of our initial comments, because we've had some very good questions. I'm going to start with you, Dr. Hamza. Patricia Brickhill asks a question which is sort of an answer to what David has just said, that the death rate, the rate of death, gratefully, is not as high as was feared at this time, although the peak of the disease still hasn't been reached. But it's said in many places, with very young populations in parts of the Middle East and Africa, more than 3/4 are under the age of 30. Do you think that is also proving to be a factor, that very young populations can perhaps suffer less?
It's I think there's like we got some positive negative facts about the number, because in a lot of those developing countries like Syria or Afghanistan or Yemen, the death reports will be you'll see a lot of elder people that will be reported, and we've seen that in the regime areas in Syria, reported as death because of pneumonia or any other respiratory system disease, but they don't state the COVID-19. So you feel that you haven't reached the peak at those countries, but you never know about are those countries has really reached a peak or not, and about what is really the mortality rate in those countries. And it's all because don't want to repeat. It's all because all the reasons, each one of us has mentioned, the taboo, the government wants to just keep their stating that everything is fine in their countries, lack of tests, lack of people afraid to go to hospitals. And yeah, this is the main situation. I just want to add something to what David has mentioned about the aid organizations' responsibility toward, especially in the developing countries. For example, in Syria, as he mentioned, about 6 million people, kind of 100% are depending on aid. Yet this pandemic hasn't only affected the health system, but it affected most of also the economic system. You can find, for example, in the UK or most of the other developed countries, there is lack of cash. The banks are just holding the cash inside, and that affected a lot countries like Yemen and Syria, with affecting most of the aid organizations programs. Because of the lack of cash that's necessary for salaries, for cash for work, for helping the families, most families in the camps, and we're through the work that at the moment I'm in touch with many organizations, trying a lot to advocate to think newly about this new normal that we are in, to move, for example, for digital currencies. And stop thinking about implementing the aid programs the way that was before the pandemic. And unfortunately, there are a lot of aid organizations that are still thinking of the developed country as before the COVID-19, and want to implement everything the way that it was before, with gathering people to distribute funds, trying to find cash, distribute it, and all of that. So like things need to be think about differently.
You make a very good point that maybe the old instruments, the ways of doing aid won't be possible in this new world, but also, as David hinted at, that the aid money won't be coming in quantities as before because the wealthy countries now feel that they're coping with a humanitarian crisis right on their doorstep. David, I'm going to bring you back in here because we had a question from Leila Jani Haddad, who was asking about how the COVID-19 has affected the flow of aid. Now, we saw with the aid appeal for Yemen, it was $1 billion short than was asked for. We saw in Syria this week that it wasn't as much, in fact, they got less than they got last year, even though the problems are worse this year. Countries aren't turning their back on the most needy countries, but they also can't do as much. What is your observation?
No, well, look, I mean, if we've learned anything in the last 3 or 4 months, it's that economic orthodoxy is there to be broken. So when governments say they can't do things, you have to ask, well, how much do you actually want to do it? Because what has been shown in the last 3 or 4 months is that there is when there's a will, there's a way. Now, the figures I've got here are that the UN has so far appealed for over $7 billion in funding for COVID specifically. So far, only 1.44 billion has been raised, and of that, only 164 million has reached frontline NGOs. So you can immediately see the double nature of the problem. And I think that there has been a kind of frozen in the headlights sense among the aid donors. I have to also say there's a lot more money going into finding a vaccine than there is to keeping people alive until there is a vaccine. And so there's a mismatch that we're finding there, that the vaccine seems like it's the kind of silver bullet to sort this out. Whereas what we know from our work in Ebola, the International Rescue Committee, we've just closed our work in 90 health centers in Eastern Democratic Republic of Congo. So the work on infection prevention and control teaches you that, number one, trust is the most valuable commodity in a health crisis. If people don't believe the messages they're being given, they're not going to go to the health center. Secondly, security is absolutely key, and that depends on local engagement. One of the questions I saw was, how do you persuade people locally? It's to hire local people. So we hire locally rather than rely on global teams. Thirdly, the prevention end of this is the right way to think about it. The statistics that Dr. Weeda gave about the most advanced medical equipment, respirators, etc. Look, there are 100 respirators in the whole of the Democratic Republic of Congo. That's 100 million people. I think that the number in Yemen is 12 for the whole country. So the answer is actually preventative healthcare and primary healthcare, not high-tech kit. And that preventative work depends on fever testing. It depends on isolation centers so people don't spread the disease. This is not high-tech stuff. And by comparison with the figures that governments are spending on their own economies, remember the US government spent $2.4 trillion on propping up the US economy so far, the sums involved are pretty small. So my plea to the governments is, look, we're not asking you to bankrupt yourselves a second time over. We're asking you a very small proportion. Remember, the UN target is 0.7% of total economic activity goes on aid. A small percentage rate will go a long way. Now, you also need to think in this context, someone else mentioned the economy, you've got to talk about debt write-offs, you've got to talk about a wider macroeconomic environment. But on the aid question that you're asking, the aid is not flowing, and it's not flowing to the right places.
But the kind of, I mean, you argue a very convincing case, but for example, even for Britain, which has committed, all parties have committed to 0.7% of GDP on aid. But if GDP is collapsing, that means the amount of aid will also collapse.
Well, that's a good point. I mean, hopefully the collapsing of GDP is a 1-year phenomenon, not a 5 or 10 year phenomenon. But you're making a good point. But remember that we're in a very strange situation where both the UK and the US are reorganizing their aid systems at the moment. There's a reorganization of DFID going on. There's the US is at the moment merging its Office of Foreign Disaster Assistance and its Food for Peace program. So you've got bureaucratic impediments as well as political impediments to aid flow at the most essential time. And that's not helpful at all.
Let's move to a slightly different topic that there's been many questions touching on this. So far we've been focusing on the health systems and how the health systems are found wanting in so many countries which were having a hard time even before this global pandemic started. But we're hearing in country after country, and David mentioned many of them, where it's not just concern about the health system, it's a concern about the economy, about the cost of this pandemic and of any lockdowns. Dr. Weeda, I'm going to bring you in here because when I speak to friends in Afghanistan, they say, you know, Afghans aren't concerned mostly about COVID-19. They're concerned about the conflict, more dying from the conflict, but also they're worried about hunger. So we have a question from Helen Richards to say, do you believe that Western approaches to the pandemic are appropriate for rural communities and even for urban communities in developing nations? Can a country like Afghanistan really lock down when millions are day laborers? If they don't work, they don't eat?
That's an excellent question. It is actually a grave situation that a lockdown essentially means loss of income, loss of daily wages. A lot of families do depend on these daily wages. So in the absence of a social welfare system in the country, then what do these people do? So it's as it is a sad situation that for a lot of these people, the poorest segments of the population, the option is hunger versus virus. So how do we help them is a question that needs to be addressed. And especially if the infrastructure is not existing in the country, even the government, when the Afghan government tried to distribute, for example, wheat or bread in different parts of the country, they couldn't put that infrastructure in place while the government was already struggling with COVID. So a lot of the population who really did need that kind of help, they could not even get it, because you cannot set up a system if you're lacking that infrastructure that hasn't worked in that direction before. So it has been extremely difficult for Afghan government to try to help those people and try to help people, particularly in urban areas, segments of the population, pockets of population who are struggling with living in camps, for example, if they are internally displaced. And when the government was distributing, for example, wheat and bread, they couldn't get it. The complaints were high that they could not have access to that. So yes, there might be, for a lot of these people, it might be an option between the virus, contracting it, exposing themselves to the virus, and hunger. And particularly another children, I know Mr. Miliband discussed women and girls. In Afghanistan, a lot of children, especially in urban areas, they might be the ones who are actually the breadwinners for the family. And then COVID has had a negative impact on them as well, that if they cannot, there is no help, there is no system in place by the government to actually do cater for such families, they are also some of the most vulnerable in the country.
So really doubled, triple blows to many people living in vulnerable situations. And we had a question from Neem Hull, who wanted to know how people like her can help, who living in the United Kingdom and in Ireland. Waad and Hamza, you know this situation all too well, because as part of your documentary work and your documentary for Sama, you also have charitable work. And I should mention at this time that if any of you do want to help, either for Sama charity or the IRC, there'll be an opportunity to do it on the website with all of the links. But Waad and Hamza, what would you say to people listening who have heard how dire the aid situation is, how bad the economic situation is? What can people do to help?
So yeah, the donation is very important part, of course, for anyone who would love to help, but also this is not like the result of the problem. I believe that, as much as we can put pressure on governments to find how they can really solve the Syria problem. I know it's not that easy and it's not simple thing to do, but in the same way, like we need to find a way to stop what's happening and to start like the conversation about accountability and push as much as we can to start this process of justice, which is like very long way. We know about this, but we need this to start. But as I just mentioned, maybe like please check Action for Sama, go also to the IRC website. Like what we're trying to provide in Action for Sama, which is a follow-up campaign to the film itself, is kind of simple tools for people to act and be in touch with the Syrian people who still working until today, like Munham team. We have partnership with Help Refugees, and I just believe that everyone can do like a simple things, and these simple things will become like a more bigger step.
And so we had questions about global leadership at this time of a global crisis, and David mentioning, you know, his concern and criticism that it's been a vacuum, it's been lacking. I think that from what you've said, I think you and Hamza would agree with that.
Yes, of course. Just like as Waad said, it's about like the awareness of other problems, advocating or like highlighting what's going on in other countries that not like necessarily 100% affect us directly, but of course it affects like all the politics, like what happened in Yemen, in Syria, in Iraq, in Afghanistan, has affected all the Western country politics, has affected their election, has affected like so much, like those Western countries on so many levels. So yes, like the horror is on the other side of the planet, but it's affecting those countries directly. On the donation sides, like yes, there are like big like aid organizations, there are huge like aid money coming from the UN or from the governments, but even the like the little helps. So every little helps, even if it's like you know, a directed donation from a family living in the UK to a family living in Syria, connected. And there are like several aid organizations that manage like to give that kind of like connection between like families in Western countries and families in Syria, Yemen, Iraq, Afghanistan. And as I mentioned, also like implementing the aid and those donations in a new way, in more like digital developed way, will keep that connection.
And I think just what's happening right now because of COVID-19, it makes everything's happening like more close to the people. Now we can feel that we are all in this together. And like, I know, yeah, like the situation in the UK is totally different from Syria, but I think people now in the lockdown start to understand what siege mean, what like, no one knows really what next minute will bring to all of us. And that should just like make us feel that, you know, like we are all as a human being in this together, and we should support each other, help each other, and not think about other people like they are the other, but they are just like a reflect of our problems, of our like dreams, and we just need to help and work as much as we can.
David, you're often someone who tries to find the light in the dark. These pleas from Waad and Hamza, which of course come from the heart, are you seeing that in this hard business of aid?
Well, I think that, first of all, for those of us who are in positions of relative security and safety, then if the people who we're helping are courageous and hopeful and determined, then what right have we to be not to be? And anyone who watches the film that Waad and Hamza put together shows extraordinary resilience. The greatest contribution to changing the lives of people in conflict comes from the people themselves. And aid agencies like mine are just there to try to help them make a difference in their own lives. And I think that you've got to, despite the way politics goes, you've got to think that there's a rational reaction to what's happened. This is a global disease. It reflects a connected world. There are too many good things about a connected world not to want to junk it. So we've got to manage it better. And I think that there is a chance that out of this mess, we do understand the significance of global health, because it's an area where actually there's room for the global system to move forward quite fast. I think secondly, the overwhelming evidence that you can prevent the disease even in the most difficult circumstances. Someone mentioned at the beginning of this panel how hard it was to get distance in densely populated areas. And it's true that if you look at northwest Syria, or if you look at the Bangladeshi camp for people fleeing from Myanmar, the Rohingya who have fled Myanmar, the density levels far outstrip that of New York or of the Diamond Princess cruise ship. I mean, you've got 50, 60, 70,000 people per square kilometer. But even in those circumstances, fever testing, which is not as good as COVID testing, but fever testing, isolation centers does prevent. Hand washing stations do prevent. Masks, frankly, prevent. And so I think that I don't think it's a question of optimism versus pessimism. I think it's frustration that it's not like we don't know what to do. It's that there are some things that can be done. And so I think it's a matter of turning that frustration into voice and turning that voice into money and money into action.
I know, David, I always quote you with the saying that you have, when you say, when you look at the statistics, they make you depressed, but when you meet the people on the ground, they make you feel optimistic.
Right, exactly. So the fact that you quote me, that's a happiness.
We've had a lot of discussion about how, and basically from all of you, that we're all in this together. And at this point in time, it's often a question of aid. But this week, we were reminded that it's also a question of trying to help countries in conflict move towards a ceasefire and eventual peace. Finally, after months of deadlock, the UN Security Council finally passed a resolution on a COVID-19 ceasefire. Dr. Weeda, you spent a lot of your time looking at the confluence of conflict and poverty, and we had a question from Sarabatia to say, what will be the impact of the COVID-19 pandemic on the security situation, and not just security, but also the rise of terrorism?
That is a very interesting question, and it is COVID-19 has had a negative impact on security situation in many parts of the world. There are terrorist organizations such as al-Qaeda and ISIS who have been trying to recruit around this time because they've been blaming, pointing fingers at Western countries, blaming the West for a spread of the virus and how they can offer support, and how quote unquote good Muslims can join them, and that would be the way of actually shielding themselves from the virus. So that's on one line. On the other hand, they've also heightened their military activities in many parts of the world. In Afghanistan, Taliban on the one hand has been in the absence of services, healthcare services, and the presence of the government in some parts of the country. They have been trying to offer some levels of governance. In late March, early April, the Taliban did launch a campaign, a public relations campaign, educating people about washing their hands, how to keep social distance, etc., etc. At the same time, the group had heightened its attacks in major cities in the country, using the opportunity because many governments in different parts of the world have been actually pulling all the resources to fight COVID. Even the military has been involved in that. There hasn't been much counter-terrorism military activities, and groups such as Taliban and al-Qaeda have used that opportunity. In Africa, for example, we have examples of both al-Qaeda and ISIS who have heightened their military activities in sub-Saharan Africa. According to some reports, about 37% increase actually in the number of violent attacks in sub-Saharan Africa was observed. It is because on one hand, the governments of those countries are trying to channel their resources towards fighting the COVID on one hand, and then if international troops are, for example, deployed in various parts of the world, those governments have actually repatriated some of their soldiers as well, which contributes to this whole vicious cycle that if there isn't much counterterrorism, countering the military activities of these groups, then they keep that situation keeps perpetuating. So that in itself on both fronts, trying to recruit. Al-Qaeda recently actually published in a couple of their magazines called COVID, the Microscopic Soldiers of Allah, and how COVID is there to actually help with the oppression of Muslims. So they've been using that opportunity to recruit, at the same time launching their attacks against civilians or whoever they do not see as on their side.
Yeah, sadly, Islamic State, one of the few people around the world who welcomed COVID-19 as a blessing for the organization. We have about 7 minutes left, and it's wonderful. More questions are coming in, and some of them are very micro questions, and some of them are big, broad questions. So I'm going to go right down to the micro questions, since we're privileged to have a doctor with us. Dr. Hamza, we had a question from West Africa. I'm afraid it's not on my screen now, but there was a question from West Africa about in the kind of situations you talked about, where people are living in camps, they don't have any water. How can they wash their hands? And also a question which was about, well, you talked about, as did Dr. Weeda in Afghanistan, about social stigma. How can people fight against this social stigma? So some practical advice from Dr. Hamza.
So it's a tough one, actually. It sounds like pretty simple question, and it's ironic that we are in 2020 and had this question about how people in one country can wash their hands. So it's very tragic to talk about it. But the main thing is the awareness, helping. It's all driven by the NGOs, basically, regarding trying to implement as much as they can of supplies to help people in camps or difficult situation, to keep to keep these safe measurements and to do the safe practices in preventing the spread of the virus.
David, I'm going to turn to you now. You're going to be our statesman. There's been many questions about, not just about leadership, but about the shift.
Remember, Lyse, that Harry Truman said the definition of a statesman was a dead politician, so watch out.
Well, exactly. It's about the shifts in great power politics, if you want to use that expression, about the growing row, of course, between China and the United States, China exerting itself on the world stage, America turning inwards. How would you describe the shape of the world powers as we move through this global pandemic? David? Oops.
Yeah, I lost you a bit there, but I think I got the main point.
The world now, is there anything which in particular concerns you about these emerging rifts in global politics?
Yeah, I mean, I think the way to understand this is that we're moving from a Western-dominated world after the end of the Cold War, which had significant upsides, but also significant downsides. It was unbalanced in the nature of Western domination, to a leaderless world. Ian Bremmer calls it a leaderless world. It's a fragmentation of power that's driven because economic power has shifted. Economic power has shifted from west to east, notably to China, but it's also, you've got new powers in the Middle East. You've got significant shifting. You've got a significant middle class in Africa as well, 350 million people in the middle class in Africa. So you've got a changing nature of political power founded on a changing nature of economic power. Now, in that context, it seems to me 2 or 3 things become very contested, and that's dangerous. The first thing that's contested is the nature of global cooperation and whether to have it or not. In a weird way, the extreme right in democratic countries ends up mimicking some of what the hardliners say in China, which is that there's got to be a new Cold War and we've got to have a separation. So the first thing is there's a contest about whether global cooperation is possible. Secondly, there's a contest about whether democracy works and whether it's the right system for the majority of countries. 113 countries around the world have seen reductions in political freedom in the last 14 years. It's a significant, it's called a democratic recession. And certainly the Chinese argument is that their system, one-party state, has made them better able to cope with COVID. So this is a very COVID-relevant debate that's going on. Thirdly, you've got a changing nature of inequality. You've got inequalities growing within countries. And when it comes to between countries, there's a new division emerging. The countries that are stable and have market economies generally reduce inequality and reduce poverty. But conflict and fragile states like those we've been talking about are dropping off the end of the cliff. And so 80% of the fragile and conflict states are off track to meet their sustainable development goals. That was before the COVID crisis hit. So my perspective on this is that you've got fragmentation of power, and that makes it very hard to predict how these three contests will play out. Contests about whether or not there's room for global collaboration, whether or not democracy is going to be the majority form of government in the future, and thirdly, the way in which inequalities get tackled, and if they don't, how they produce insecurity and unsustainability. All of that is, I think, makes this a very, very significant, pivotal time, even without the kind of global challenges that are faced, whether in respect of climate change or pandemics like the one we're living through. But the global politics means there's a real contest. And my view is, just the last point, when governments are in retreat in the way they are, it's up to NGOs, citizens to step up, companies in the corporate sector to step up, because there has to be leadership from somewhere. If it's not coming from governments, it has to come from civil society.
Well, that's a lot for all of us joining this conversation for Agile Rabbits to think about: global collaboration, democracy, inequality, and of course, this global pandemic, which still hasn't run its course. Now, you wouldn't be part of this Agile Rabbits conversation if you weren't someone who, I think, tries to see a bit of light in the dark. As has been said, that in this crisis, perhaps for all of that's bad, perhaps something good can come out of it. Perhaps there can be a time for the engineers and the Imagineers to try to reset our world. So before we end this conversation, I would like from all of you just one sentence, if you can find, after all that we've talked about in this discussion, something good that you think might come out of this crisis that is affecting all of us around the world. Starting with you, Dr. Weeda.
Sorry, I turned off my, I was on mute. I think there would be more collaboration and more looking inward rather than waiting for help to come from outside. More local solutions to problems. And that would be a great beginning for many of developing countries, actually, in one sentence.
That's good. Dr. Hamza and Waad?
So I just want to add to what Dr. Weeda said, because I think now it's the like perfect time for everyone to understand like that any challenge could any one of us in this world like go through, it could be the same and even like more worse in so many other places. And as much as we want like our life to be more smooth and more easy, I think we just need to help other people to have like similar like situations.
Just what I would say that it's probably like one of the first like crises in the world. You feel like all, as Waad said, like we're all in this together. So like from someone coming from a developing country, we always feel like we're on the other side of the world, or like people don't really understand or care what the difficult situations we're living at. But now it feels like really like people will understand the suffering, and with the much like several like platforms in the world now, like Western people can really be connected directly to frontline workers in the crisis areas.
Yes, and may I just add, it must be, I'm not sure what correct word to use, but interesting for both of you. After filming and working in the hospitals in Aleppo, Waad, you've been filming in the hospitals in the UK, and Dr. Hamza, you're doing aid work here in Britain. It must.
I mean, like, for me, you know, like being just in this hospital, like working with Channel 4 News, not from inside Aleppo, but from London. And with Hamza, with his work with al-Kateab, you know, like when he was in Syria working as a doctor and now helping like doctors and frontline to get at like the least that they really deserve. I think it's just totally different like shift of our whole life, but it means like so much, I think, for just from personal perspective about what this world is about.
Yeah, I think there could be no better example about how the world is interconnected to see your efforts, the Hussein Akkad and other Syrian refugees who found a new home here in Britain. And when the pandemic struck, they were the first to say, I want to help a country which has given me help at a time when I was fleeing a crisis on the other side of the world. And finally to you, David Miliband.
My sentence would be that there are more resources to do good than any time in human history. And what we've learned is that if we don't use them, we all suffer.
Well done. I think that's one of the things I'm going to take away from this, David, trying to Waad and Hamza like that, and Dr. Weeda's thinking about what you said. And we all hope that you're right. We're going to have to sadly draw this to an end. I'm going to take all the powers of a moderator and force our two Agile rabbits to come and show their faces on the screen, because we have John the artist and Kate the engineer, and they make this rabbit jump around. You have the free thinking artist of John and the very structural thinking of Kate the engineer, who are behind this conversation tonight and all of the conversations before and that are yet to come. This conversation was recorded, so if you missed some of it or would like to listen to it again, do go back to the Agile Rabbit website. And also to remind you again, if you've been inspired or touched or in some way affected by our conversation this evening, you can contribute to the work of Action for Sama, the charity set up by Waad and Dr. Hamza. The International Rescue Committee does excellent work around the world. And of course, there are many charities working in Afghanistan. You've had such wonderful questions coming in, from the very specific ones like how to wash your hands to the big ones about global politics of our time. That is a compliment to all of you who have joined us for a conversation which is not just about the ideas of our time, but is actually about the lives of people in our own society, and societies which, well, in our socially distanced world may seem far away, but they're not far away at all.